Everest 2 high-risk study evaluated percutaneous mitral valve repair with Mitra clip device. Mitral valve repair is conventionally the realm of cardiac surgeons. The repair of the mitral valve in cases at high risk of surgery is being done with percutaneously deployed clips. Mitra clip to reduce the severity of mitral regurgitation was evaluated in Everest 2 HRS. Safety and utility of this approach, the acute and 1-year results were published initially. Patients enrolled were those deemed high risk for a surgical repair of the mitral valve with an estimated surgical mortality of 12% or more. Of the 78 patients who underwent the Mitra clip procedure, more than half had a previous cardiac surgery and the mean age was 77 years. The 30-day procedure-related mortality was 7.7% versus 8.3% mortality in the comparator group. 1-year survival was 76%, which was significantly better than the 55% survival in the comparator group. 78% of the survivors had grade 2 or less of mitral regurgitation at 1 year. NYHA functional class was also remarkably better from class 3/4 in 89% at baseline to class 1/2 in 74%. Quality of life scores improved and hospitalizations were reduced. Significant reverse remodeling of the left ventricle was also noted at 1 year. 5-year results of Everest 2 showed that even though surgery for residual mitral regurgitation was more often in percutaneous repair at 1 year, the need for surgery between 1 to 5 years was comparable in the two groups. The Mitra clip grasps the mitral leaflet edges and reduces the regurgitation volume and the preload of the left ventricle. In the long run, it reverses adverse left ventricular remodeling and improves clinical outcome. But the results may be poor in those who have long-standing left ventricular volume overload due to severe mitral regurgitation. These persons may have irreversible left ventricular dysfunction and poor prognosis. Hence, it has to be done before irreversible LV dysfunction develops. Here are the first set of important references. Second set of references are here.